Well, as you probably know, the problem of breast cancer is actually a less frequent disease in African Americans, but unfortunately, it leads to greater mortality.
Specifically within the African American community, we have a big issue in terms of awareness, not truly understanding what the risk factors for breast cancer are. We propagate myths, for example. A lot of Black women think, well, that's a white woman's disease, so I don't have to worry about it. It does not discriminate. Breast cancer does not discriminate.
Regardless of the stage of diagnosis, African American women are less likely to be cured and to survive. So we need to collaborate to use the tools we have to improve the outcomes.
It was Anthem Blue Cross that came back to us after a very successful first-year pilot and said, "What's next? We know that you have African American women as a priority across the state, so would you consider partnering all 7 affiliates and doing something even bigger than what you did in LA and Orange County?"
The California affiliates have for a long time been working together collaboratively to do public policy and address public policy issues, but this is unique for the state of California. They've come together to attack a problem like this.
Anthem has put a large amount of money, $400,000 on the table, and we are challenging other people in the state of California to be aware and to collaborate with Komen to make this money go further to make a significant improvement in the lives of women and their families in the state.
At the launch of this initiative, we had a lot of support. The media was there, and the women came out in numbers, and it felt really good that we could all, as a community, help to make a difference.
Man-made map, man-made counties with a dividing line that says this is Howard County, this is Orange County. But we're seamless in terms of our resources and our pooling and our goal. What's the main goal? Why are we here?
Women don't really care which affiliate it is. Who cares if it's the Orange County affiliate or the Los Angeles affiliate? Is there a way to bring a service, bring mobile mammography, bring education to the community and do it effectively?
As a state, we can not only obviously work together and get strong results, but we can build a model to take to other major metropolitan areas. And I don't think that this model will be exclusive to just an African American initiative.
When we're successful in 2 years, I think what we all have to remember is that this is a marathon, not a sprint. So we will have just begun the process.
2 years is an important interval. I mean, it gives us time to learn a lot. It doesn't necessarily give us time to solve the problem, but it gives us time to understand what the major elements are to solving the problem.
We're accountable to the women, and that's the most important thing. So whether there was an Anthem grant or not, we have a responsibility as Komen to do everything that we can, particularly with this community, to see that line go down.
Komen affiliates are the heart and soul of this organization, and examples like this really set the standard for all of us. And again, I'm just so proud of them and of all the work that's happening out there.